Very good morning, everyone. On a relaxed Sunday, we have pulled everyone to a learning session here. Today, I need to thank Dr. M.A.K. Viraju Anand Raju for giving us an opportunity here to share the latest technology in dynamic navigation, which is going to be the future of dentistry very, very soon. This all started with just a telephonic conversation about 8 months ago, where he was always passionate about launching newer technology in his institution. So first we started this session like just making a short presentation to the management team member in Vishnu Dental College. Then he was saying that if the efforts is going to be the same, why not we also share the complete know-how to the entire faculty team and also to the existing postgraduate students and the alumni of the institution. That is how it started. So then it was all happened right now in just 2 to 3 days time. So we need to just speak to the right speakers and make a good presentation to give a complete overview about the concept of dynamic navigation. So the today's session, we are going to have two speakers. We have Mr. Eric Chang, who's an Asia Pacific head of dynamic navigation Navident, the global leader in this field. And we have Dr. Rahul Shah. He's an oral maxillofacial from Mumbai. I'll introduce the profile of the speaker. Before that, my name is Mani Krishnan. I head the business of Marks Biotech, and we are the partners of Navident, that is a dynamic navigation business in India. So let me get back to the session right now.
So Mani, thanks a lot. As you rightly said, it gives us all an immense pleasure to welcome the resource persons of today's program, Dr. Rahul Shah, who is an oral and maxillofacial surgeon from Mumbai, and Mr. Eric Chang, Director Sales and Marketing, Asia Pacific region from Taiwan, of the company ClaroNav. One of the products is the Navident. And obviously, Mani Krishnan, the CEO of Marks and Biotech company, and his team. We also have amidst us our Vice Chairman, Ravichandran Rajgopal, our faculty from other sister engineering institutions, our proud alumni, postgraduate students, and house surgeons of Vishnu Dental College. A very good morning to all of you. At the outset, I would like to thank all of you for being here on a Sunday morning to learn the newer technologies in dentistry and upgrading your knowledge and skills. I have been following this technology for close to about 8 years now, and now I'm convinced that this technology is definitely going to help us in delivering utmost care to our patients, and which I personally feel is a lifelong process. I would like to thank our alumni who are representing us in various institutes across the country by actively participating in today's program. All this would not have been possible with the cooperation of Mr. Mani, who is popularly called as Mani in the dental business circles. He is known in the dental industry as a person who is very quality conscious and has been associated in his tenure in the business in the most reputed companies like Dentistry, Noble Biocare, and that speaks about the quality of the individual. And after his stint in these companies, he started his own company called Marks Biotech, and which primarily deals with 3 implant products, namely the B&B implants, the second product being the Navident from ClaroNav, and third product is the Rocky Mountain Tissue Bank bone grafts. Thank you, Mani, and I would request now you to introduce our resource persons for the day, and we are all eagerly looking forward to learn. Thank you, one and all. Have a great learning.
Thank you, Doctor. Thank you for the kind words and giving us an introduction about our company and all the products what we deal with. Thanks a lot. The first I'll come to the learning outcome. That is what everybody has come over here. Today's session is going to give you a complete overview about dynamic navigation technology. This presentation will cover the history of dynamic navigation, not just dentistry, but also related to healthcare also. And also gives a complete details about this technology, where in dentistry, this technology is going to be useful. and at the same time, what problem this navigation technology is going to solve in the field of dentistry. And what is a clinical know-how, what each and every dentist need to know if he need to adopt this technology into his practice or into a university or into a dental academy, and what benefits it offers, and how do I use this in everyday practice. And also incorporates the complete latest technology in the field of digital workflow, both surgical and the prosthetic side. And this session will also have a complete case presentation of different scenarios. The speaker will share a lot of cases, what they have done, not just the success stories, but at the same time giving a complete experience of how he started and how he has mastered this technique of dynamic navigation with Navident. And also, finally, there is a lot of scientific clinical documentation which substantial to this technology. This is going to be shared by the speakers. First, I'll introduce the speaker for the day. We have Mr. Eric Chang. Eric, thank you for being here for this session. And in fact, I got a lot of inspiration about dynamic navigation just because I've been interacting with him for almost a year's time, and he doesn't sleep. Almost his session starts from around India time, 10 o'clock, which will be midnight. He has actually transferred the passion, what he had in dynamic navigation to me. That is how I ended in taking up a fantastic solution to India. He has been in this industry in clinical marketing and medtech space for almost 15 years. In the last 4 years, he has been an expert in the field of dynamic navigation. And he has worked with multiple clinicians across Asia Pacific. And in his experience, he has trained a lot of dentists from a basic understanding of dynamic navigation and making them an expert in the field of dynamic navigation. And he has created excellent key opinion leaders in the field of dynamic navigation right from start. And he collaborates very, very closely with universities and a lot of educational academy in Asia Pacific region, his goal is to incorporate dynamic navigation as part of the curriculum in the postgraduate studies itself. He has been successful with universities, and thus we have already partnered and we have the experience in working with universities. We are going to also take it up to the university level so that they can get the complete know-how with they start the practice. Right now, the session is I welcome Mr. Eric Chang to share the screen and take the session from now on.
Thank you very much for providing me this opportunity to introduce the dynamic navigation technology in the dentistry. And today, for my topic, I will separate for the two things. First, I will focusing on how is dynamic navigation works. And then in the second part, I will introduce how we can going to apply the dynamic navigation system to our daily dental practice. Before I start to my presentation, I would like to share the case. First, this patient received the oral treatment and looking for the implant placement. And if this your patient to looking for the surgery from you, and which approach will you do? Freehand or static eye surgery or the dynamic navigation surgery? So before we go more deeply for this technology, maybe you can take 10 minutes to think. So when using dynamic navigation surgery, first, it's allowed for the real-time verifications for the position accuracy. And of course, we know it's dynamic, it's not the static guide. And it also for minimize invasive surgery to occur. Sometimes, according to the situation, that maybe we have to approach like flat press surgeries. So it works for the dynamic. And it also allows for the surgery for water sooner and reduce surgical time when improving and the irrigation ability. No implant manufacturer dependent. It means we support to globally implant brands, and it also increasing the surgical confidence. And we are from Toronto, Canada. It's our headquarters here. So in the future, very welcome to visiting our headquarters. And we have two CEOs. Doran, and Caldio. They hold this company. And this is Jason, my boss, and I'm responsible for the APAC market. And here's our history of our company. We start our business from the 1985, and we launched our first commercial surgical navigation system for brain surgery on 1992. And then 2004, we launched our Micron tracker. It's a visible light optical pulse tracking system. And our Navident device is depending on this technology and this device, Micron tracker. And the 2010, and everybody knows the intraoral scanner, the big company is Trios. And in 2013, that we start to launch our device to the ENT market and also the Navident. So overall, we have over 35 years experience in medical market. And what is the guided surgery histories? We know, start from the 1994, the first cranial product we called ISG start to the brain surgery. And to 2005, it's become a standard for the brain surgeries. And how about the guide surgery to the dental? We know, start from the 1995, we have another choice for the steady guide that you can update the CBCT data and take the dental impression and send it to the technician. Then after 7 days or a week, the technician will send back for the steady guide for your surgery. And now we have the better choice for the dynamic one. So we start to our new product Navident for the dental. And here is our first case on 2013, April 24. It's our prototype. And 2015, we got the CE mark. And 16, we got the FDA approved. So what the Navident, the core performance here is accuracy, usability, and applicability. And so far, we launched our 7 different generations for our major software. So you can see we call the Navident 3. And back to our technology is our Micron tracker. It's the first version based on optical tracking system for surgery. Use the stereoscopic vision in real time to detect and track spatial marker object. And the object we create is the X point. So we can add this X point to the patient's anatomy or to the instrument, which one we want to track in the motion. So in our dental system that you will see, we can mount the head tracker, this one, and also the jaw tracker to the patients. And attach this drill tech to the handpiece, then you can start to navigations. So basically, we are based on the tracking system, this camera, and it's a medical degree. And how it works. Everybody knows a couple of years ago, we started using a map. And we launched the smartphone, we can very easily to using the Google Map or the GPS to guide the direction from A to B. And the Navident is the same concept. It's provided like the GPS. When you have the patient's the CBCT data and it's as the map. And when we attach the detector to the handpiece, and now you can following your guidance and see where is your drill in your anatomy. And of course, our Micron tracker, the medical degree camera, we also provide to Masar or Medtronic or Brinket, the big company worldwide, to help them to develop their own navigation surgery systems. And here is our video.
It's a very versatile, innovative technology that definitely has served us well, both for the patients and for us.
Navident represents the next generation in computer guidance.
Using this technology absolutely gives you an edge.
Navident is changing implant dentistry by enhancing your skills with the power of dynamic surgical navigation. The same technology, now the standard of care in neurosurgery. This allows implant placement with confidence in minimally invasive, sometimes flapless procedures. Take a look at the advantages. Studies show navigated surgery to be more accurate than freehand surgery. Increased efficiency and flexibility because no guides or labs are needed. Plus, you can change the plan during surgery. Reduced harm to patient. The possibility of fewer complications and faster healing. Increased patient acceptance and referrals. You're leveraging the latest technology to provide better, safer, less invasive care. The system is compatible with any implant system and CBCT. You can navigate other dental procedures in real time and calibrate any tool. Navident turns precise diagnostic information into surgical precision in 3 simple steps. You'll start with the patient's diagnostic CT scan. Import the DICOM data into the Navident treatment planning software. This mapping gives you deep insight into your patient's anatomic constraints, enabling you to navigate bone structure, adjacent roots, sinuses, and nerve locations. Navigated surgery is ideal for implant placement in aesthetic areas, cases with minimal bone, or in any situation where precision is paramount. Next, utilizing Navident's groundbreaking technology called Trace and Place, trace 3 to 4 teeth, abutments, or structures to register. Do an accuracy check and go to surgery. Approach the implant site and be instantly guided by the target.
It's like GPS for implants because you look at a screen and that screen tells you exactly where to go. It's basically your roadmap on how to place the implant.
This actually takes only modifies my surgical time by a slight bit. Actually doesn't affect it all that much. I find that I need to tweak something. With a study guide, I cannot do that. With Navident, it's 2 seconds.
15 years of R&D plus close collaboration with the academic and medical communities paved the road to proven accuracy.
We want to give our patients every edge possible to get the results that they're after in terms of predictability, aesthetics, and function.
I was a little skeptical about using Navident, but it's pretty incredible. I never really thought I could be more accurate with placing implants and doing better for patients.
It is our responsibility as clinicians to stay at the forefront of the innovations that help us better serve the needs of our patients. And a perfect example of such an innovation is Navident.
We've been leaders in technology throughout our history, and this is just a natural extension.
Because you want the best for your patients and the best for your practice. We invite you to join the Navident family.
Okay, so now I will start to introduce our product, the Navident. And everyone won't go to learn something new, but it's always changed the conventional steps. But with our product Navident, you don't have to change anything. Become the expert. First, you only need the CBCT, and if possible, you can obtain the STL file from the intraoral scan or the model scan and send it to the lab, and the technician will create a digital workshop back to you, but it's options. So back to the Navident, you only have to learn 3 steps. First is planning. The planning step is like you take the CBCT and load the DICOM data to your laptop, then you can start to do the planning. And the second is about the trace registration. We will call it for the patient preparations. And the third, that is placing, tracking, is about the instrument preparations. So here you can see the picture here. We have a camera and the head tracker for instead of the patient's positions and the anatomy, and the drill tech. So in my presentation, I will walk around in step 1, 2, and 3. So first, how to planning a case. You only have to give us the CBCT, the DICOM data, and then load the data to the Navident laptop directly. Then you can start to do the planning. And as I mentioned, that you also can have the STL format that including maybe like an intraoral scan and then a model scan. And even better is you have the digital workshop to have a better result and the predictable STL file. And of course, now more and more the third-party treatment planning software to the market, we also can load the file from the different treatment planning software, like the AutoCAD or the Blue Sky Bio. And the second is about the trace registrations. Trace registration is created by our CalNav teams. You can trace the patient's natal tooth, the PFM crowns, the abutment in the patient's mouth already, or the bone screw, even the bone surface. And the last thing is about the tracking place. We can tracking on the patient's jaw, and of course for the maxilla and the mandible, and any kind of the dental instrument, like the surgical handpiece for the implant surgery, and the high-speed handpiece for the endodontic surgery, and the piezo saw for bone augmentation or the sinus elevations, open window. And of course, you can attach to the different hand instrument, like the oscillotone, to do the quest approach, and even the striker. So first, how to start to planning a case with Navident. You only have to do is load the DICOM data to our laptop. And because we support to different implant brand in the globally, so we are not including any library. You just have to select the implant body shape and modify the length and the platform of the diameter. Then you can switch in the position and modify that. And as I say, even better, you can have the STL file and superimpose with the CBCT. After that, we can go to the next steps, how to prepare the patients. And the very important part is that after we do the treatment planning, that we have to make the camera can read the patient's anatomy and how to connect between the software, the DICOM data and STL data, and with the patients. We are depending on the head tracker or the jaw tracker here. So before the surgery, we have to do the registration. And the registration is mapping of patient's physical jaw structure and the CBCT image in the Navident software. And the software will identify where the anatomy structure are in the space. So we have the two options here. To maintain the registration between the jaw and its CB image throughout the procedure, the patient jaw pose needs to be considerably tracked to ensure this. The optical mark part, I mean the track, we also call it the head tracker or the jaw tracker here, is affixed to the jaw in which the surgery is being performed. So you can select for the head tracker for maxilla case only, or you have 3 different types of the jaw tracker. You can connect to your tooth by the resin material, or a very easy one, you can using the bi-registration material to attach, and after 1 minute setting, then you can perform the surgery. Or even for the fully mouth rehabilitation case, the patient come with no teeth, and then you can very easily to using the bone screw to fixation the jaw tracker on the bone surface. And for more flexibility, we can make also resin material to combine the jaw tracker. sometimes in your operation room, you have to do this part. And when patient come for your treatment, and he have already in the another implant in the mouth, you don't have to remove the previous implant. You just connect to the temporary abutment or the fixture mount to engage the jaw tracheal solid. It's very enough. And also you can put the jaw tracheal directly to the teeth, and after the surgery, you can take it out. And how to start to the trace regenerations. After you connect the head trachea to the patient or attach the jaw trachea to the patient's jaw, then next, you have to back to the Navident software to select the landmark. And you have to select the 3 or more jaw surface landmark located easily visible on the CBCT image or a STL file. And then use the available optical track number tools with like the special tip we call the tracer tool to perform a short trace over the jaw surface and starting at each landmark locations. And of course, sometimes the surface of the last 3 structure are not easily visible on the CT scan, like a patient have the PFM crown or the image have the artifact. So maybe you can use the surface scan, like an intraoral scanner, the data, or the model scan data. So I prepare a short video to demonstrate how to do the trace registration. And then after we select the landmark, we will using this tracer tool. It have a tiny tip here, it's 1 millimeter. And we will using this calibrator to touch together. After that, the camera will detect and calculate the tip automatically. After that, you just put the tracer tool on each landmark you select. Then you can start to moving like a painting. And it's the video for the demonstrations.
We can see that an average single tracing takes about 17 seconds. So the whole tracing required for the registration of the patient's jaw with its scan would take about 1 minute. I now verify the registration's accuracy by touching with the tracer's tip on different locations on the teeth and comparing its physical location on the tooth with its virtual representation on the screen. Once accuracy has been verified, we can proceed to the surgical navigation part.
So I will say the learning curve with the Navident first is how to do the trace registration skill. And then we also provide another function in the Navident software. When you select the landmark on your planning, it's provided the predictable registration deviations analyzed. Based on different location, like you select the different bone school, the numbers or the locations, even like you select the different landmark on the teeth, the software will show you the numbers to guide you the number, how the implant will very accuracies. And we show in different color, the green one, yellow one, and the red one. So as possible, you have to select the landmark for the result of the implant to become the green one. And the last step is to place and the tracking. And for this part, it shows how the camera to detect the handpiece or the instrument. And for Navident, we are not only support for the implant surgery. If you connect the handpiece to different Biotech to the high-speed piezo hand instrument, and that you can perform to different indications. We are using the Biotech. Again, it's the X point, like can make the camera to read the position and then tracking the motions. So very easily, like we just need using the silicone tap to engage the mental adapter to each different handbrake or high-speed piezo surgery or even a striker. Then we can go to the next step. We will using this calibrator to calibration the instrument's ethics and the different type of the surgical drill or the bone and even the saw. So this part we are calling the calibrator, and it also can send into the autoclave. And this shows how we to do the instrument calibrations. First, we will take this part behind in front of the camera and then do the 1 turns for the ethics calibrations. And the next, we will change to the different instrument like the drill or the zygoma drill and even the saw cut, and connect to the calibrator and show again from the camera, and that will be automatic to the calibration, the tip stance or the positions. So now we have already prepared a head tracker or a jaw tracker for present the patient's anatomy. And also we have already prepared the handpiece or instrument for the assistance. After that, the Navident will calculate the corresponding position of the anatomy and the drill, and they show the guidance and the position real time on the monitor. So it's the real case that we start from the ethics calibration and the tip calibrations. After 2 steps for the instrument, that when you put the drill on your target, and the Navident will automatically detect and show the position of the drill, then you can follow the guidance to move your drilling up and down, or even mesial buccal or distal palate, just moving, and you just follow the guidance from the screen. And we also provide the depths bar here. So basically, when you performing the surgery, you only have to do is looking at the target view, because in the main screen, we provide a different view for you, and then the panel section view here, but most easier is to just following this target view. And what are the information shared from this target view? That including the distance between your drill tip to your target. It's the number shows here. And it also shows the deviation or the angulation with your handpiece to the target here. And for the 6.3 millimeter, it's guide you the vertical distance, the length of the implant. And it also shows from A means the patient's anterior, and the P means patient's posterior, and the R is patient's right side. And the next part, I will introducing how to perform the navigation in the daily practice. So for the indication that we can facilitation the digital workflow process, and also navigate the full mouth rehabilitation case like the 014, 016, and the zygomatic implant surgery or the pterygoid. And even we can use the Navident in the endodontic or with the piezo. And of course, with the piezo surgery, you can performing the lateral window cutting phase. So back to this case. After receiving the osso treatment, and we can see the patient still needed the 2 teeth for the implant surgery, the lateral incisor and the first premolar. But in a limited space, how can you to place the implant? By freehand? Or consideration the aesthetic issues that may be due to the flat plate surgery is much better. for the result. Or if you want to place the implant very precisely, maybe you will think or consideration to place a steady guide here. But very important part is steady guide still have the space for the support under the sleeve. So the better choice is using the dynamic navigation surgery. So again, what you need is to the planning and after the patient preparation and the calibration of the instrument, then you just need to follow the target field. And then you will get the perfect result even you do the flat press surgery. And then now, more and more article or the KOL will show they to deal with the anesthetic zone like this case. They will perform the socket share technique or they call the pit. So again, you can attach the Biotech, I mean the tracking system to the handpiece. And when you prepare the root mesial distal cut to separate the root, you can following the screen. And it's the result and already for the implant placement. And now we are talking about more deeply for the full muscle rehabilitations. The first case here is the patient who want just to remove his perio teeth and obtain overdentures, and he looking for the locator support. So the goal for the implant to support the locator abutment is important part is to make two implants as parallel as they can. So for the Navident, you can very easily to place the two implants on the planning side and set the implant parallel for locator abutment automatically. So you can see here the numbers in the two implants. It's a 0 degree to 0 degree. And the second step here is the trace protocol. And again, when we do the trace registration protocol, we have to put the tracer tool on the solid object. So for these three remain teeth, it cannot be used because it's the parallel teeth and it will be mobile. So we will press the bone school and take the CBCT again. After that, you can using the bone school for the registration purpose. So here is our result. You can see here, the numbers for the two implant is only 0.59 degree deviation for the first one implant. And then for the second one is only 1.29 deviations angulations. So it's a very good result for the abutment, I mean the locator to support the overdentures. And the next is about the digital workflow approach, like the 014 or 016. When you start to prepare the patient's data, first, of course, you have to take the CBCT. And then next, you want to precisely to place the implant. And after the surgery, maybe you can do the immediate visualizations. So you have to do the planning very ideally. So what we will suggesting that you have to get a digital workup. So superimpose the two different informations in Navident and place the implant. And of course, you can see we have an example here. You don't have to press to do the planning from the Navident side. You can also using the team viewer to remote. So like you can have a teamwork with the surgeon and the prosthodontic, even with the technicians using this platform. And again, because we support all different, so you don't have to library. You just select the implant length and the diameter, then press in the Navident planning software. Then next, it's a very important part. After you planning, you can very easily from the Navident software. And you can see this STL file is including the prosthesis here and also have the implants locations and the numbers. After that, you can export the STL file to your technician, and the technician can mailing or printing the provisional before the surgery. And next step is fix the jaw trachea with the bone school, and we're using the full teeth for the tracing purpose. And just following the different implant location. And again, it's automatically. So during the surgery, you don't have to touch the screen. And the very important part is sometimes when we do the immediate placement, like this case, you take this tooth out and you're trying to do the immediate placement, but maybe you will find the socket for this implant will not enough for the stability. So you can very easily to change the treatment planning directly. You don't have to do anything more. After that, you can put the provisional to make sure all the hole was very precisely for the MUA abutment and the temporary cylinder. And it's the final result here. And some users will asking, or some doctor will asking, if I'm using the third party or the different training software, can I using the data and the load to the Navident? Of course, you can do that. So here is an example here. You can using the Blue Sky Plan or even the AutoCAD or the 3Shape and export the implant position file like STL file. And in this case, we export 3 different files like the bone windowing for the bone reduction purpose and the implant locations. And of course, you can mimic the MUA abutment angulations here. So it's very easy to superimpose 2 different files. We're just using the landmark here to superimpose together with the CBCT. Then you can start perform your surgery. The next is the zygomatic implant surgery. And now more and more patients for the full mouth rehabilitation, but they got a very serious problem with the bone conditions. So maybe you have to combine the zygomatic implant. And how are you to do the zygomatic implant? First, before patient to take the CBCT, you have to press the bone screw. You can press the bone screw on the buccal side or from the occlusal side. And again, back to the first steps, planning the implant. Of course, you can combine with the STL file. And the next, after preparation for the patient, you can start to tracing the bone screw here. And for the bone screw for the tracing, you can using any kind of the bone screw you want, like the ortho screw or the tending screw. But please do not using the tap screw because that cannot provide the enough stability for the tracings. And the next, just following your guide and press the implant or the drilling protocol. And it's the result for the both sides of the implant. You can see it's very precisely for the entry point, and it's only 2 millimeter deviations. And how about the angulation? We have the 6 degrees arrow because it's for the study. The surgeon want to press the implant to compare to another one with the dynamic. So he pressed the first implant with free hand, but he do the drilling protocol with navigations. And at the second implant, he always following the target view and press the implant also using the dynamic navigation. So you can see here we got the better result here. And of course, you can press the pterygoid implant. And again, if you don't have the STL file, you can using the Navident planning software. We also provide you the different processes, the crown, so you can select and follow the target view to place the implant. So you can see the result is much better, even in the very dangerous room here. And for the Navident, we are not only for provide the support for the implant surgery, we also got approved for the guided root canal treatment. So for the endodontic doctor, they were using the microscope daily. So you can see this picture, you can combine the Navident and the microscope together to do the calcified canal purpose. So you can using the rubber dent to do the isolations and connect the jaw tracker to the patient's teeth and attach the Biotech, the tracking system on the handpiece and the calibration and following the guidance. So for the 10 to 12 calcified care distance, you can very easy to prepare and define the route. And again, you can using the piezo for the episiotomy. Just touch the bone surface and follow the screen on the Navident, and it will guide you and show you the image from here. And next, when we start to talking about piezo surgery, that first come to your mind, maybe you will think, can I use the Navident to do the lateral window approach? Of course, you can do that. So very easy 3 steps here. First, the planning. You can using the function to create a block here on the sinus window outside. After that, you can calibration the saw tip here. Then you can start to do the surgery. And the camera will automatic to tracking your location of the saw position here. So you can do the sinus open window real time. And the different surgeon may be like the different instrument. So again, of course, you can change the piezo to the high speed with the carbide burr. And in the different module here, you will only see the tip positions on the screen. And the very important part for the Navident is provided you the real view that you can always avoid the critical anatomy, like the artery here. And it's the result after you do the minimize the lateral window approach to do the sinus augmentations. And it's another benefit here because we know sometimes we will invest in the new instrument. That means that you have to change everything. What I say, the Navident can load the DICOM data from different brand. So you can using the so you can using the Sonona or you can using the Premaca or Asahi, Hitachi, any brand, because you just upload the DICOM data to the Navident. But sometimes when the machine have the evaluation that will provide a different FOV view, for the Navident, we can support to very small FOV. So for this case, you can see here, the original data just like the 5x8. So after trace registration on the teeth and the calibration, the instrument, and you can prepare the very difficult area here. You can see the tip locations. So not for the skill experience, you also can see where you are. And so far, when we start to launch our Navident to the market, and we cooperate with different countries, university, or the professor. So we have the over 36 articles in the world now, and it's always keeping increasing. Okay, so here is my conclusion for my presentation today. And what is the advantage of the dynamic navigation system? First, is less bulky, like sometimes patients have the open mouth limitations problem, and you don't have to using the steady guide. And the second, it's a real-time visualization of the drill movement, and its accuracy can be verified during surgery, and the plans can be modified if it's necessary during the surgery. And you don't have to waiting or change the schedule because the patient cannot change the schedule for you. And you can get the direct view from the surgical side, even from the patient's mouth and from the screen. And it's the better tactile sensations, and you don't need to fabricate the guide or use a special instrument because it supports all implant brand. And of course, you can save in time. And the last part is very important because we cannot not only focusing on the product selling or developing, we also creating a platform for the academic. We call the DNS. It's the Dynamic Navigation Society. And we have the speaker global worldwide. And so far we have the 2 speakers from India, Dr. Rahul Shah and Dr. Sanjay here. And we have a lot of the hands-on training course or the event for the doctor who want to learn the new technology like the dynamic navigation or how to cooperation with the digital workflow. So you can contact to us. And it's our first DNS Global Symposium 2019 in Rome. And we will organize the next event in coming soon. So again, I will say thank you to everyone to join this webinar and give this opportunity to provide me to introduce our technology to you. Thank you very much.
Eric, thanks for your time and thank you for sharing the complete know-how related to Navident. The next speaker for this session is Dr. Rahul M. Manohar Shah. Dr. Rahul Shah is a oral maxillofacial surgeon based in Mumbai. He has his private practice in Mumbai and he is also a consultant to Jupiter Hospital, Thane, Mumbai, and also to various other top practices, premium hospitals in Mumbai. He has an experience of more than about 7,000 oral surgery procedures, and he is one of the global certified Navident global trainer and had the privilege of working closely with the Clarano Navident headquarters at Canada almost for the year. And he has also contributed to the newest update of Navident 3.2, which has just got released a month ago. He has helped various clinics to get started with navigation solution, not just in Canada, but also in USA when he was in Canada. He is the first Navident user to adopt the orthodontic surgery and maxillofacial trauma amongst the global users. He has a dedicated practitioner who has implemented the cutting edge technology and techniques what he has learned, and he has been a presenter in multiple conferences. May I request Dr. Rahul Shah to take the next session, please.
I would like to thank Marks Biotech, Mr. Mani, for giving me this opportunity to speak in front of such a educated audience, and also all the dignitaries and the directors of Vishnu Dental College for giving me this opportunity to share my experience about Navident with such senior practitioners and very senior surgeons as well. Eric has completely taken us through the entire history, how to use Navident, and he has shared with us exceptional cases. What I am going to be speaking today is mainly why Navident, why I have used Navident, and why I feel all of y'all will be happy to use Navident in your everyday dental and surgical practices. All of us are aware about how complex the head and neck anatomy is. There are a lot of challenges we face as surgeons related to head and neck, which many other surgeons on the body do not come across. One of them is, yes, a very complex anatomy. Secondly, we always deal with restricted access areas, may it be the maxilla or the mandible. All our procedures are carried out in aesthetic zone, maybe dental implants or any other facial surgeries. There are innumerous vital structures, various nerves, various arteries, which we have to deal with when treating oral and maxillofacial region. And this being a continuous functional unit, we cannot ask the patient not to talk, not to eat for a month, and sort of hope that the body takes care of whatever we do over this 1.5 months. This is an absolutely functional area where the patient would be chewing, talking continuously. So we face a lot of technical challenges as surgeons, as dentists, when we come across this oral and maxillofacial region. As a surgeon, when I started my practice, I used to get very excited and I used to feel awe-stricken looking at the virtual planning softwares. I used to feel that today there is technology where we have the patient in front of us in terms of a CBCT data with intraoral scans. Once we overlap the intraoral scan with the CBCT data, we have entire bony and dentate anatomy. Then came the time of facial scanners where we could scan the soft tissue and overlap it in front of the CBCT or the DICOM data. And practically we would have the entire patient's head in front of us on the computer. We could do many procedures on this, starting from dental smile designing. We could do orthodontic planning. We could do resection planning. We could do reconstruction planning on the software. On the software, it looks beautiful. Probably we could sort of cut half of the face, do a mirror image on the remaining half of the face on the software, and try to make it look as symmetric as possible. But then all of us are aware, once you are on the operating table, you are on your own. You have to use your experience, your guts to complete the virtual planning which one has done on the computer. That's when I used to feel, what if there is something which I have which will be able to guide me in real time when I am performing such a surgery? That's when I was browsing through the internet, when I came across dynamic navigation as a product which is available in 2-3 companies all over the world. I started researching this topic in detail. I've came across few machines. There are companies which make only one machine, which is the same for a neurosurgery, which is same for the spine surgery, and also they have a craniofacial software in it, so you can use for head and neck surgery also. But the machine is so big and so expensive that you cannot move it from one operatory to the other. Forget about leaving one building and taking it to another building. Then I came across one company which makes only for dental implants. I did research that company and I realized that their progress in terms of technology is restricted only to dental implants. They have not come across with options where I can use it for a wide areas in oral and maxillofacial surgery. I had visited Cologne for IDS, which happens every 2 years before this pandemic. And I saw Navident product, a sleek, small little machine, but so powerful that it could be used in different cases. I have been using Navident since 2017. From 2017 till today, there have been 3 major updates in Navident, which have helped me evolve from just using it for few surgical options today to endodontics, dental implants, sinus surgeries, piezo-surgical cases, orthodontic, and I hopefully in the future for prosthodontics and lot more applications. So what I'm trying to emphasize over here is this is one product which is so small and sleek that I can put it in my car and carry it from one place to another. it has a heart, which is a laptop, which is so powerful that I can use it from orthodontic, dental implants, trauma, endodontics, all these applications. Plus, it is so user-friendly that if you give 2 to 3 days of training to this machine, on the 4th day, you would be confident to use it for most surgical procedures. Having said that, Eric has already covered this topic, that what and how Navident works. To simplify it, the satellite, which is the heart of our GPS. Our phone is where we are, which keeps moving, and the maps which are fed into the software like Google Maps is the CBCT data. So the CBCT would be the map. Here, the camera is the satellite which is seeing it, and the functioning is carried out by the laptop. And the jaw tracker, which is held on any instrument, would be the moving object. So what the camera does is it sees the moving object, and with the help of a very strong software, it can tell us where is it moving in relation to the CBCT of the patient. Thus, we just need to do one extra step. We need to tell the software where the physical patient is in relation to the CBCT of the patient in the software. That process is called tracing, which was shown with the help of an amazing video by Eric. In today's presentation, my first case, I will be showing you all a case of dental implants. It is a detailed case in which I have shown all the steps in real time without editing. How much time would it take to plan a case? How much time would it take to trace a case? How much time would it take to place an implant using this technology? And also how fast and easy is to do post-placement evaluation of our case. What I need is basically a CBCT. If I have a DICOM data with me, I can carry out navigation surgery. If I have an intraoral data with me in the form of an intraoral scan or a cast or an impression scan, then I can do my planning better. But there have been many cases where I have treated just on the basis of DICOM data. Today, I would be showing few cases where I have used navigation for dental implant placements, for maxillofacial trauma cases, for maxillofacial resections in onco or any other pathology. Facial asymmetry is orthodontic surgery, for sinus surgeries, and in endodontics as well. I will be showing you videos of each of these cases, and during the video of each of these cases, I would be giving my tips, my inputs on how navigation has been useful for me during this surgery. This is a case of dental implants which I have used using Navident software. For any planning, we have to do the panoramic planning. Once we are happy with the panoramic view, for a lower, we would first mark the nerve. This case is actually a case for upper. This I'm just showing to complete the planning aspect. One can see how fast it was to draw the nerve. Once I'm planning to do the case, first I would do is prosthetic planning. With each tooth number, there are different crowns which are already present. I can change their dimensions to my desire. Once I have done with the angulation and the orientation of prosthetic planning, if I'm happy with it, I can continue with placement of implants. Eric had shown you all cases where if you already have a mock-up from a lab, you can directly import it as an STL. That will give you a more detailed prosthetic planning. Once I have placed the implants, I have an option of grouping them, making them parallel to one another, making sure for me that once I do this case prosthetically after the placement of implants, I have taken care of all the possible planning options. Then I have started calibrating my tracer. I have chosen 3 distinct points in the arch. And this is the actual tracing which is being carried out by me. As one can see, it hardly takes about a minute to do the tracing of a case. If it is an edentulous case, we need to place bone screws in the edentulous region, and the tracing is just by a touch. So the tracing is faster in an edentulous case than in a dentist case. Once I have done the tracing, I am checking if my tracing has been done accurately. Since I am satisfied with the accuracy of my tracing, I will go ahead with the next step, is calibrating my hand instruments. In this case, my physio dispenser handpiece. The calibration takes hardly 30 seconds. Once I have calibrated my instrument, I'm just touching it to the adjacent sides to check. This is me performing the surgery. As you all can see in the top left corner, I have placed my instrument, the drill tip, intraorally where I plan to place my implant, and I am seeing the screen to make sure I am at the desired point in less than a millimeter deviation. Once I am satisfied with the point, I will start drilling it. Once the cone on the left bottom of the screen is in green, that means I am at the desired angle. This entire case, I will be changing each and every drill and placing the implant through the navigation software. There has been no editing done from the part of calibration of the instrument to the end of the video, for you all to understand that there is no change in the time required to carry out the surgery. Yes, there is a curve, learning curve, which one has to give about 3 to 4 days before you start with your first surgery. Once you are thorough with the training part, then following the surgery will not come across with any hindrance of extra time required. I am actually seeing at the screen while doing a surgery in a maxillary case where I have planned my implant just kissing the sinus floor. This is the final drill I am using. Once I'm done with my osteotomy, I can place the implants through Navident software itself. I can change the width of my drills in the software so as to exactly match the width of the drills I'm using while I'm doing the osteotomy. This helps me to have an exact orientation of the position of my drill intraorally. So as the wider the width of my drill gets, the drill seen on the screen also starts becoming wider. I need to calibrate each of my drill tip before using it intraorally whenever I change the drill. But as you all can appreciate on the screen, it hardly takes 15 to 20 seconds extra. This is the implant placement, and this is the post-implant placement evaluation. The top portion is my planning pre-operative CBCT. The bottom is my post-operative CBCT. I give 3 similar land points for orientation. This is how I'm delineating my implant. This is what I had planned, and this is what I have achieved. The software is so sensitive that it gives me a 5-degree deviation, a 6-degree deviation, an entry point of 1 mm deviation. This is possible because I have done a pre-surgical planning and I am replicating it. If I have done a freehand planning in my head, looking at the CBCT, there is no way, even if I take a post-op CBCT, I can be sure that what I had planned is what I have achieved. Because in freehand, whatever we place, we feel is always accurate, not necessarily true. This is a case of a mandible fracture, which was a body fracture, and I had planned to place a single plate in this case. Since I had to place a single plate, I have to place it along the midsection of the body where there is the mental nerve, there are root apices of the teeth present. So as to avoid these vital anatomical structures, I plan to use Navident to be sure on exactly where I will be keeping my holes for my screws. I used my own indigenous technique to fit the jot tracker with the help of wires. Since any other technique would involve hindrance during MMF, that is maxillomandibular fixation, this is a case where I used 3 points for tracing. After tracing was carried out, I used the machine in the tip only mode where it basically navigates the tip of my instrument for placement of my drill between the teeth above the inferior alveolar canal and above the mental foramen. This is an operation theater setup where sterilization is of utmost importance, and Navident being a very portable and a sleek machine, it does not hinder with the operation theater environment also. Also, it can be calibrated on any of the handpiece, be it your surgical handpiece, be it your dental air rotor handpiece, be it your hand instrument. a piezo-surgical unit. Thus, I could place the plate in the ideal position without injuring any of the vital structures. Next, coming to a case of marginal mandibulectomy. In this case, first I imported the DICOM data. I imported the data where I had planned the resection with 1 centimeter margins. Luckily, I could make sure that I was above the inferior. Luckily, I could make sure that I was above the inferior alveolar nerve. Thus, I could resect the mandible with 1 centimeter margin and still preserve the inferior alveolar nerve. Could I have done this freehand? Yes, I can do these freehands, and I do these surgeries freehand very often. But the confidence I had to tell the patient that I would be preserving his inferior alveolar bundle was the advantage of Navident in this particular case. And also the fact that I am keeping complete 1 centimeter margins plus preserving the inferior alveolar nerve. Here I am doing the postage stamp. The software is guiding me for each of my postage stamp, and then I would be connecting these postage stamp and resecting the mandible. Most oral surgeons on this platform will be able to appreciate that in a OT setup, there are restrictions on the movement of the surgeon because one has to preserve and maintain sterilization. But Navident in no way hinders with an operation theater environment. This was a resection with the preservation of the nerve. This case was done in 2017, a case of bilateral sagittal split osteotomy using navigation. In this case, we had planned to do an advancement for the mandible, but the software at that time had the option only to track. The software at that time in 2017 had the option only to track the tip of the instrument. I could not track the entire drill. But again, as we use the postage stamp for my first cut where I had to be distal to the lingula and above the lingula, my second vertical cut where I had to make sure I am between the buccal and lingual cortical plates, and the most important third cut where I had to be sure that I have completely cut bicortically the inferior border. Once I was assured of my cuts in these three planes, I continued the rest of the osteotomy without navigation. But today,
this is a case
with Navident 3.0 software, you have a saw mode. In this saw mode, in this case of orthognathic surgery, one will be able to appreciate that my entire cut was completely guided when I was doing this particular case.
Cleft patient had a severe negative overjet. A complete digital planning was carried out in which a digitally prepared surgical stent was made, which was then 3D printed for the use of surgery. But this is a very routine procedure. Imagine a situation where a surgeon has a tool where he could use navigation while performing what the surgeon has planned. This is also a 3D printed stereolithographic model
which was used to carry out a mock surgery like the analog method. But here, specially, navigation was used. Tracing was carried out using the TAP protocol, that is trace and place protocol. An accuracy check was done to see the exact accuracy of the tracing. This is a video showing while I was doing my osteotomy, the saw blade was navigated during the entire surgery. Previously, with the older software, there was just a provision of the point of the instrument which could be navigated, which was very useful. But with the new technology in which there is a saw mode in the 3.0 Navident software, as you all can see, there is navigation not only for the tip but also for the angle in all the three axes, the depth, making this surgery a very predictable procedure. In this particular case, the osteotomies were planned just anterior to the mental foramen, making sure to avoid any injury to the inferior alveolar nerve bundle. Navigation here gives a confidence to the surgeon on where exactly the instrument is cutting during the procedure. This machine being a very portable machine, I carry it to different operation theaters in different hospitals where I consult. Because of the trace protocol, there is no need of taking a navigation with any fiducials in the mouth. Any CBCT or a CT scan can be used for planning and executing of these surgeries. There are many parameters, as you can see on the screen, which guide a surgeon when the osteotomies are being performed. Navident is a very versatile product. We can use a piezo, our regular micromotor handpiece, an air rotor handpiece, any hand instrument if the handpiece tracker can be fixed onto it firmly. I would say the limitation of the use of Navident currently is up to the imagination of the surgeon on how to use it in various indications. In the post-op photographs, we can appreciate the extraction of the premolar and the osteotomy anterior to the nerve bundle without injuring the nerve bundle. The surgical stent was used to do the plating in the desired manner. The approximation of bone is very accurate. This is how the patient had a correction of negative overjet. This is the pre and post-op comparison of occlusion. Thank you. This is a case.
So that was a case of orthognathic surgery. Also, I could use Navident in this particular unique case where the root piece was left behind few years back. Since it was few years into the sinus, it was completely encapsulated by the sinus lining and did not change in its position. Since it was at a fixed particular point, I could use navigation to make a window very small, exactly buckled to the root piece, and just pick it up with the help of a tweezer and then suture the cavity back. Also, this is a case of endodontics for a calcified canal where you could directly do your access opening with the help of Navident. Thus, covering this entire spectrum of my experience with Navident over the last 4 years, I have used Navident for more than 50 surgical procedures, few of them dental implants and most of them maxillofacial surgical procedures. And I'm always open to ideas to use Navident with different indications, new procedures which I can use. I have been using static guides for last 4-5 years again. I would not say that you require dynamic navigation in every single case where a static guide is used. But in my experience, I have found few disadvantages with a static guide where dynamic navigation is very, very useful. Static guides being a blind procedure, I am finally following what the lab, the technician, or the other surgeon has planned. There might be a few surgeons who plan their own cases and place them. Still, they would agree with me that in certain critical case scenarios where the bone is really, really thin, you still have a doubt of following the stent blindly. Here, navigation makes a major difference because this is your extra set of eyes while doing surgery. It is real-time navigation. And say in an immediate extraction case, you extract the tooth and realize that the buccal plate has fractured along with it. And you do not want to place the implant in that particular site and want to shift it to probably the adjacent socket. With the help of previously fabricated guides, you cannot do that. You have to follow that guide or not use the guide. That's not the case with navigation. You can easily change the plan at that time during the surgery and navigation would continue as it is. You always need an extra guided kit to do a guided surgery. Not all companies provide a guided kit. Not necessarily every guided kit is a completely guided option. Some have only probably pilot drill guides. Some people can do their osteotomies but not place the implant through the guide. Some kits do not have tissue punches. Some kits are not used for edentulous cases because they do not have anchor pins. This is not the case with dynamic navigation or Navident. With Navident, there is no extra armamentarium required to perform a surgery, except that you have to fit the handpiece tracker onto any handpiece you are planning to use for surgery. May it be your endo, that is your air rotor, may it be your piezo-surgical, may it be your physio dispenser, may it be your surgical state handpiece, your saw, any instrument. Basic disadvantage of guides is if any bone alteration is required, either augmentation or reduction, the guides has to be kept on changing. First guide probably is just for reduction. The second guide will be for placement. Thus, your procedure complication increases, your cost keeps on increases. This is not the case with Navident. All procedures are carried out. There is no need to change anything. Your planning each and every step from reduction, augmentation can be carried out on the same software and can be easily implemented using Navident. As there are no physical guides or hindrances while performing surgery, there is no compromise on irrigation with the help of navigation. There are no physical guides, thus the fit of the guide or the stent does not come into picture in this case. You have a freedom of space in that restricted area while performing surgery. Even if it is a restricted mouth, if you could do freehand, you can do navigation surgery. That's not the case with static guides. In restricted mouth opening cases, static guides tend to be a hindrance to put the drill through the guide from the occlusal side. With navigation, with Navident, you can do multiple plannings on the software and execute them seamlessly with Navident. Just to wrap up, why I have loved Navident why I like Navident. First, I have had the opportunity to be at Toronto, get myself trained there, and use my knowledge to spread it to other fellow surgeons in the US and Canada. So I know the company CEO personally. He is an engineer by heart, truly dedicated to research and development, and believes in innovating with each day. Even today, it would be unfair for me to reveal few secrets, but they are working on a handpiece which the surgeon has to hold, and the navigation software will move the head of the handpiece like a robotic arm, but instead of the entire robotic assembly, just a handpiece, which will directly change its head according to the angle, and the surgeon has to just hold it, push it apically, and bring it out. Imagine, once you have that, you are completely supported with technology, with the freedom of you being able to change something if you have to during surgery. So this is what the company is working on today. They already have a prototype which is available, but it being a North American company, they follow the standardization, the various guidelines in terms of their FDA, their CE protocols. Thus, any new product which they get into the market is completely vetted out. It's completely cleared from all the related authorities. It might take a year or more for that particular product to come out, but mind you, once that is out, it will change the game completely. That's why I keep saying it is not just the product, but the heart of the company itself, which is very, very versatile. They are a very friendly atmosphere. Even if you have bought the machine today and you give them an opinion about something that can be improved or changed in the machine, and you will be shocked to know that in the next release, they will acknowledge the fact that so-and-so doctor has given this tip to us, and we have tried to bring about this change. They are working on the machine being as sleek, as portable as possible. I have carried this machine cross Canada-US border multiple times. So it is like a bag or a luggage which can be taken from one place to another. It is very, very accurate. Like Eric has shared, there are more than 36 articles which have been published for the accuracy, which can be found on different platforms on the internet for one to go and check the accuracy of the outcome. This company is been into technology for more than 25 years, and it has been the global leaders in terms of technology at each and every step. May it be brain surgery, may it be ENT, or Navident, that is dental surgery as well. As dentists, we tend to bend a lot. We tend to try to go and sit inside the patient's mouth and operate. And that gives a toll on our posture, our backs. But like a microscope, once you start using Navident, you will realize your posture has improved. In my opinion, ergonomics is a lot of advantage for us as surgeons, as dental professionals, to be practicing for a longer period of time. And yes, Navident helps in this a lot. Most important thing why I have been using Navident is it gives me an extra pair of eyes during surgery to see in areas which generally is impractical or not possible to see with naked eye. When I am close to very, very vital structures during surgery, may it be dental implants, may it be sinus procedures, or any other maxillofacial surgery, an extra set of eyes are always useful. I would like to thank all of y'all for giving me a patient hearing on a Sunday morning and allowing me to share my experience in terms of this exciting, new, innovative technology called dynamic navigation and this amazing product called Navident. Thank you.
Thank you, Doctor. Thank you for your elaborate overview and your experience, what you shared with Navident. As a clinician perspective, at the same time, who has been a part of the Navident third release. And you have seen both the side, the company side of it, the clinical side of it, and the pain factor, what as a clinician, what they face, and how this technology is going to be helpful for them. Thanks a lot for sharing the details. So far, Eric was giving a perspective related to the company side, the technology, the history, the possibility. And Dr. Rahul Shah gave a perspective related to the clinical side. How as a clinician needs to look at this product and what are the learning he has and what are the possibilities with this product. I will just give you an overview of what exactly is happening in India as far as navigation surgery is concerned. We have a few key users of Navident in India already. As you know, Dr. Rahul M. Shah is a oral maxillofacial surgeon from Mumbai. We have Dr. Sanjay Jain, who is the periodontist and is also a key opinion leader for Navident. And we have Sanjay Jain is a periodontist, and we have Dr. Neeraj Kinariwala. He's an endodontist, and he does a lot of courses, and he is passionate about guided endodontics. So he has mainly bought Navident only for endodontic procedures. We have another user, Dr. Bhaskaran. He is from a place called Tanjavur in Tamil Nadu. He runs the Raga Dental Implant and Laser Center. His passion was getting into the latest technology, and his practice is a completely digital practice. And right from any impression taken in his practice, it is a digital impression. He incorporates digital planning, digital workflow in every implant and a regular case what he has done. And he has taken up this product in February, and he has really done a lot and experienced real success with Navident. We have Dr. Ashwini Ballerao, oral maxillofacial surgeon from Mumbai, a very experienced practitioner, a trainer, and of the excellent skill set. And she is one of the users of Navident. And we also have a university who has taken up this equipment, and there is a partnership between that is the University Savita Dental College and University of Glaxo. And this partnership was made possible mainly, the connecting gap is dynamic navigation Navident 3.0. There is a clinical research going on. We just commenced this on 28th of June. If you look at the activities in India in 2021, in spite of the pandemic affected our moving from one city to other, we already completed 3-day residency workshop on complete understanding on dynamic navigation with Navident in January 2021. And later to that, we did a 2-day full mouth rehab case workshop in March 2021 with the latest 3.0 version. And we already explained the concept related to digital workflow, digital advancement in dentistry in the Indian Medical Association in Tanjavur. And I'm very happy to also share, we already have a clinician in India, that is Dr. Bhaskaran Raga Dental. He procured this product in February 2021 on the 9th of February. And within 3 months from that time, he completed 50 cases. When you see it globally, every step what he's been doing with 50 cases with complete digital workflow. And right now, his practice is completely not just a digital practice, but has become like a navigation practice in every case what he does. And as I mentioned to you, the MOU between Savita University and University of Glaxo with navigation technology. And we already did a continuous dental education program at Savita Dental College on advanced dynamic navigation technology. This is the past. Future, the plan activities, what you have planned right now, there's an upcoming Dynamic Navigation Society's Proficiency Certification Program. This will be a 1-day program in Mumbai in the month of August. Tentative dates is 22nd. We will announce it in the next 3 days. And in Chennai in September 2021. And our goal, our immediate goal is to start a Dynamic Navigation Society, an India chapter, that is in October 2021. And the agenda here is going to be for the 1-day proficiency certification. It is related to whatever you're seeing right now and everything what you're seeing right now, how you can actually adopt in your daily practice. A live demonstration of the mannequin, you'll be able to see live patient demo in dental implants, endodontics, and every procedure.
Yeah, this is Dr. Suresh Sajjan,
yes,
Principal, Vishnu Dental College. Okay, so it was a very nice presentation, Dr. Rahul. And you have given the versatility of how and where all used and how positively it can affect the prognosis or outcome of the treatment protocol or the treatment procedure. So that was very nice. It was quite an enlightening for us. Most of us are not using this technology, maybe because of the cost also. That's what that comes to when it comes to the India. We generally first look at what is the cost of any new instrument that comes here. Second thing would be service. As you rightly said in the beginning, you didn't have anybody to handle things for you in India. And only later when you got trained yourself, then you're able to manage the things very well. Those are two main things that we always look for, other than the credibility of the instrument, of course. So thank you very much on behalf of Vishnu Dental College and our Vishnu Education Society. I thank you for enlightening us, and Eric had given a lot of insight about how it works and much of detail about it. And I also thank Marks Biotech, Mr. Mani, bringing in this technology and exposure to us. Thank you very much.
Thank you, Doctor. Thank you. Thanks for the kind words. Doctor, there are 2 points, Doctor, which you highlighted, the challenges in India when any dentist or any practitioner or a dental chain or a college makes an investment. One thing is on the service, next thing is on training and education, and not just initially, but also for the future also with updates. I understand, Doctor, when I brought this product navigation technology, it is not just training an individual or an institution just for the installation alone, because we are in touch with every practitioner who has every user in India, any type of a case, what is they are planning. We have been a part of the discussion. We have a planning team where they actually plan the procedure and share it to the doctor. That is a back end what we already do. And we have a comprehensive training module and training programs available. And we are no way, Doctor, we are less than anything what has been done in abroad. As I mentioned in the earlier slide also, that we actually were the first to use the 3.0.1 version full mouth rehabs trackers in India. Later to that, one of the famous Navident specialists in Italy, Stephen Early, used it 3 days later, but we used it at least ahead of him earlier. So the company is sharing all the support and all the information and knowledge to us, which I want to see to that our practitioners are all in the key panelists in the global arena. That is an assurance from our end.
That's really great to hear. Thank you, Mr. Mani. Because why I was mentioning that is many times it happens in our country. Several things do come here, and later on there were no follow-ups, and then the people who have got will be looking for some spare parts or some service, some kind of it, because every instrument will have some wear and tear in time to come.
Correct.
And there won't be anyone where they can look for, and people keep changing from company to company as well. And that's one major problem that we generally face. Although cost is one thing, because many people would still be able to afford and put it across, and then they find that it is not worth, because there won't be anyone to follow it up or to whom to look for. And when they directly write to the company would say that we don't have anybody in India, and we will not be able to help you in this matter. So that is where the things go and hit the wall, So that's why I was just mentioned that, because this is very interesting technology, and this would go a long way.
Doctor, right. Thank you. Dr. Raju?
Yeah, Mani, can you hear me now?
Yeah, very well, Doctor.
Yeah, actually, I was there throughout. I mean, I was the last part also. I was trying to talk, but it was not going through. It was an excellent session, Mani. I mean, since I'm aware of the technology, what differentiates ClariNav or Navident from the other navigation systems? Its versatility to be used for different applications in dentistry. And that was the reason I had been in touch with you, because if it is just going to be implants, though implants have come as a major part in dentistry, but there are still some more applications in dentistry which we use on a day-to-day basis. So I think there Navident has scored the mark, and I was trying to explain my core team about, it's endodontics is one thing, but I'm sure tomorrow we could do a much more precise a crown preparation or a bridge preparation, because the application is the same. So it's a matter of, as Rahul very clearly pointed out, to what use you put to. And he very clearly said in endodontics, whether you can use it for access preparation. I would say, yes, we have to use it for access preparation to do minimal damage to the tooth so that you have the minimalistic access. Then you do good biomechanical preparation. And at the same time, you're able to visualize everything on your CBCT. So at the end of the whole game, you're giving the best to the patient. And as I think Dr. Sajjan very clearly pointed out, this technology is definitely going to be here for a longer duration. And as a personal note, we were discussing about how we have to incorporate at our institute. So I think it's been a very nice Sunday morning, and I'm sure most of our students, most of our alumni, this particular concept is very new to them. And I'm sure they have learned something, and definitely we can work on from here forward. And Vice Chairman, Mr. Ravi is there. The reason why I told you in the last moment about our engineering faculty also, because as Rahul very clearly mentioned, this product was developed by an engineer. The need was a dentist need, but the whole concept was developed by an engineering team. So that is the reason why our Vice Chairman, who is himself a mechanical engineer, and our biomedical engineering head of the department, a couple of engineering faculty are also there, trying to understand the technology, how it is being put to use to dentistry or any other application. So thanks a lot again. And if Ravi, would you want to speak anything, or can we?
Dr. Anand, so I just wanted to thank Mr. Mani and his entire presentation that he's put together. Certainly it's useful for us, and so I want to thank you. So I know that all our faculty benefited on a Sunday. So thank you very much, Dr. Rahul and Mr. Chang. So thank you very much. Yeah.
Thank you, Doctor. Thank you for giving us an opportunity and showcase the complete solution to the entity. Thank you, Doctor. Thanks a lot for being on a Sunday. Thank you. Thank you all.